Thank you so much for joining us. And joining me today is Dr. Sar Ahmed. He is the CEO and founder of Desert Orthopedic Center. Doctor, thank you so much.
Thanks for having me, Chris.
You got it. The topic today, shoulder arthritis. What specifically is that and what are the symptoms?
Shoulder arthritis is when you wear and tear your shoulder and the joint is degenerated, and typically you come in for pain and stiffness.
And what age are we talking about? Is there a specific age?
Not really. Depends on what the arthritis is caused from, but generally as we get older, our shoulders break down. So does the rest of our body.
Sure, of course. And how do you diagnose that in your office?
I do a clinical exam and get some x-rays, and that is pretty definitive for arthritis.
Okay, and then the next step would be treatment options, right?
Yeah, so they're usually coming to me for two different problems. They're coming for pain, and then they're coming for functional problems. Okay. So what I typically recommend is let's get something there to reduce your pain and inflammation and get your functional levels up, rehab the shoulder.
Okay, so non-operative.
Non-operative treatment, yeah.
Okay.
Typically I like to recommend non-operative treatment for as long as possible.
Okay, and if that doesn't work, then we're talking surgery?
Surgery typically. So we're doing something called a total shoulder replacement.
And explain that quickly.
So the ball and socket are replaced by me with metal and plastic.
Okay, and the recovery time, first of all, how long does that procedure take?
About an hour.
An hour, and recovery time, when do they get back to that quality of life?
Typically, you're looking at 3 months of a graded increase in their physical therapy, sling, restrictions, but after that, they're free to go, and takes potentially up to a year for them to get all their muscle strength back.
Got it. Okay. What's another surgery that you perform then?
Typically, if that's the only problem that they came in with arthritis, then we're talking about a shoulder replacement. If they're coming in for arthritis and rotator cuff tear, rotator cuff are the muscles that help move our shoulders around, then we switch gears and do something called the reverse shoulder replacement.
And what exactly is that then?
Exactly like it sounds. You take the ball part and you switch it over to the socket end. You take the socket part and you move it over to the ball end.
Okay.
Reverse shoulder replacement.
Is there more time to recover for that?
It's recovery is about the same.
Oh, really? Yeah. Okay. All right. And you guys are where are you guys located?
We're located in South Scottsdale and North Scottsdale.
Oh, a couple locations.
Couple locations so far.
Doctor, great stuff. We appreciate it. Thank you so much for being here.
Thank you, Chris, for having me.
You got it. And folks, we'll see you next time.